Hi, I'm Dr. Jim Carlson. This is for case number 01658, 6-year-old King Charles Spaniel, which has diabetes. As we look at the IHT analysis, the owner's goal is to try to determine a more holistic way to manage diabetes. And so if we look at the IHT analysis, we see the 30 base point readings. We can see 3 weak areas on the upper part of this test, and then 1 stressed area down here. The fatty tissue endocrine control point and the kidneys were weak, and then the joints were stressed. If we look at the sensitivity report, sensitivities can be allergies, but in this particular case we didn't see allergies on the test report. But we get into basic groups and we see that fabrics and materials, cotton is a more common product that we might see in dog beds, also rayon. And so anything that would potentially have this product in the rugs or dog beds, things like that, even on the couch, could be potentially rev up the central nervous system and cause issues with the endocrine system. As we come in on to the food groups here, we can see fruit and also sweeteners. Sweeteners, it's interesting because xylitol is in chewing gum. This particular patient is sensitive to xylitol, so that's going to be one we definitely want to avoid because of potential serious health implications there. But you notice that diabetes, and then we have sugars and sweeteners, can be one of the reasons that any type of sugar in the diet could make this particular patient sensitive to diabetes. Okay, so what does this all mean? Well, if we go up and we think about diabetes being the main symptom, but we have these weak areas, weak fatty tissue, endocrine control, kidneys, and joints, is that we look at endocrine control, that's going to be where our pancreas is. And we can see that the pancreas is responsible for insulin secretion, but it's also controlled by the kidney down here. So if we don't have good kidney control, if we have weak kidney control, we're not going to have good pancreatic control. And if we don't have good pancreatic control, then we can have insulin problems as far as regulation. Also, the stressed joints. So we see that the kidney is responsible for bone and cartilage. And so if we're dealing with joints, bone and cartilage is going to be involved as well. So if we're going to help this patient, first of all, is that we want to control diabetes with insulin. That's typically for life. We can help to reduce the dependency over time. The pattern for this particular diabetes is going to benefit most from Romani 11. And Romani 11 helps to rebalance the pattern of diabetes. And we're going to be on this product for 3 weeks. And then finally, in order to rebalance these points down here, for 3 months we're going to be on Drainpar drops at an average of about 2 drops a day until we retest to see if these numbers corrected. And if they have, then we know that we have a good chance of making this patient at least feel better as a diabetic, and hopefully over time reduce its dependency.
Can you explain a little bit about the Drainpar drops and how they work?
Well, Drainpar drops, if we think about Drainpar as being a homeopathic remedy, is going to be necessary as a base point drop. But then we're going to customize it using our focus infuser to be very specific for these 4 weak and stressed areas. And that's going to help to rebalance. Once we're rebalanced, then restoration and recovery can be evaluated.
Okay. And then also one more question that the owner might have. Could you explain how the bone and cartilage and the kidney are related?
Well, the kidney in Chinese medicine is responsible for calcium, phosphorus regulation. It's also important as an endocrine hormone gland itself in stimulating the pancreas, the pituitary, also the thyroid. And so if it's regulating calcium and phosphorus, then bone made up of calcium is going to be one of the things that the kidney is going to be responsible for.
Okay. And then how does that play into the endocrine and pancreas?
Well, if we look here, we see that the kidney controls the endocrine pancreas. And so if it's having problems here, it'll definitely impair the pancreas's ability to produce a sufficient amount of insulin. And so that may require that we increase the amount of insulin injections in order to bring the blood sugar down to a more appropriate level. But by balancing this out, you can see that once this is in equilibrium again, is that the insulin levels, as far as the amount that's given by injection, can potentially be reduced.
And how soon will all of this stuff be available for pickup?
The availability will be this week. I will contact my technician and we'll get the laboratory results over to her and get the treatments ready and call the owner.